A big development in the fight against the coronavirus pandemic. A government advisory panel voting 17-4 to back Pfizer's vaccine, kickstarting a massive distribution chain across the U.S. The U.S., of course, following Canada and Britain in approving this vaccine. We're joined now by Dr. Stephen Thomas, Chief of Infectious Disease at Upstate Medical University in Syracuse, New York. He is also lead principal investigator for a clinical trial of the Pfizer vaccine. Doctor, it's good to see you. Thank you for your time. I know you've been very close to this project, part of the trial itself. I know you guys go by the science, but I'd like to get your emotion here for a minute and your reaction to the video you saw this week of the first two people in the UK getting this vaccine.
The primary emotion was one of hope. If the FDA is able to issue this emergency use authorization, it provides us a very powerful and significant tool to bring to this fight against COVID, and it could help us if combined with public health behaviors like masking and social distancing. We could really start to finally impact this epidemic curve and have trends go in the right direction instead of continually going in the wrong direction.
The panel voted 17-4. I'm sure there are some who will wonder about those four. Is that unusual?
Well, based on the deliberation that I was hearing, because I attended, I attended the meeting today, it was not surprising to me that it was a split vote. And the split, I believe, was mostly because of the lower age range. And so when the trial first began, it was from 18 to 85 years of age. And then they expanded the trial to include 16 and 17-year-olds. They're asking for an emergency use authorization for ages 16 and above, but there's not as much information in that 16 and 17-year-old age group. And so there were some people on the committee that had some concerns about that.
So this is the first bright spot we've seen in quite a while, Doctor. But Dr. Fauci today said that 70 to 80% of Americans need to be vaccinated before we can get back to some semblance of normal. The latest study from AP found fewer than 50% of people in the U.S. will get this, and fewer than 25% of the Black community plan to get this vaccination. How do you reconcile that?
I think you reconcile that by through transparency, and today, that panel was a public hearing, and people from the public had a chance to express their opinions and their thoughts. Transparency. So today we published in the New England Journal of Medicine the data, and so that gives everybody an opportunity to look at the information themselves and make their own conclusions. And it really requires messaging. It requires talking to people and explaining to people and listening to people as to what their concerns may be and providing them answers to those questions. There's always this sort of baseline level of hesitancy within the country about regarding vaccines in general, and unfortunately, that group has gotten a little bit larger. And with a vaccine being developed in 11 months, I can understand that people are asking some questions, but I would assure them that there were no safety corners cut in this process. They just companies took on financial risk, and the regulators worked day and night to move the process along.
We have a minute left, Doctor, and I have two questions. So if you could give me 30 seconds each, how long will it take for us to see some kind of impact from this vaccine, where we'll see the numbers go down, and as a result, we can say this is working?
Well, I think we know from the trial that that the vaccine works, but it goes back to the comment that Dr. Fauci made. You're going to have to really roll out millions and millions of doses, and people are going to have to take it, and they're going to have to continue to wear masks and do social distancing. If they do those, both of those things, by this end of second quarter next year, we could be in a much different situation than we are right now.
I'll leave the last 30 seconds for you to make your case. Why is it so important for people to get this vaccine?
If people want to be able to stop wearing masks, have their kids go back to in-person learning, if they want to be able to go back to, having their small businesses open, eating in restaurants, going to live sporting events, this is going to be the pathway to those ends.
Dr. Stephen Thomas, it's always good to see you. Thank you for your time, sir.
Thank you.